Dr. Rewilak, I get a lot of questions from patients or families of patients with frontotemporal dementia that often I can't answer myself. And to the best of my ability, I try to give a medication that might calm things down. But I'm going to call on your expertise for some of these common problems. I've got a patient who's constantly humming out loud. And generally this isn't a problem. It's a big enough house that they could be on separate sides of the house. But if they're in public and it's becoming an embarrassing situation, what should the caregiver do to try to encourage that person to stop or to be more quiet?
Um, well, the first thing that I would suggest that the caregiver does is begin to observe very specifically and systematically when that humming is likely to occur. A lot of people come and they tell you that something's happening constantly, and when they begin to kind of stand back a little bit and and observe things in a systematic fashion, they discover that it's maybe not as frequent as they thought. Maybe what's happening in that situation is that the embarrassment perhaps of the caregiver is really contributing to her perception that this is happening on a very frequent basis. Having said that, it would also be interesting to know whether there are times in the day or specific contexts where that humming is more likely to occur. And then the questions you would ask yourself is, what's different about it occurring in this context and not occurring in that one? So by coming off automatic pilot really and looking at the problem a little more systematically.
I interpret that as that's his way of responding,
Yeah.
because he can't respond verbally in the way that he used to. Is that possible? Is that a possible interpretation for what stimulates that response?
If that evoked that response reliably, then you would think that any kind of verbal engagement would bring that on. I was thinking of it in a slightly different fashion, that humming maybe at some level is a self-stimulation of some kind, where the individual is not having, in fact, maybe enough input from the environment, so is needing to kind of self-stimulate in that fashion.
How about when people grind their teeth with bruxism? I've wondered if that's the self-stimulation kind of thing too.
It may well be. There's all kinds of behaviours that people with frontotemporal dementia will do that are repetitive in that way, and part of it may be the self-stimulatory kind of sensations that they get from it.
Okay, so let's follow that thread a little bit. Let's say the wife notices that the bruxism usually occurs around dinner time and continues until the patient falls asleep.
Mhm.
What can we do about that? There's not necessarily a stressor involved, but it's a time of day.
Okay. I'd like to know whether it's actually constant, you know, and if it's not, is there anything that kind of makes the individual stop? Is it maybe when he's beginning to be engaged, for example, looking at television? Is it possible to distract him? For example, when you began to say that asking him a question in your office, kind of sets it off, I was kind of heading slightly differently as I began to think about it, that maybe when the humming is taking place, is to distract him onto something else, something that he finds enjoyable, maybe a topic of conversation that you can kind of pull him in on. And for that reason, it's really important for individuals to understand, caregivers to understand the history of that individual, and especially with the family, there'd be sufficient knowledge of that individual's interests and hobbies and things like that, and can you get him onto that then begins to displace the humming.
Right, and I like what you said before. A lot of us assume that what you mean when you say start to observe when it happens, that we should be observing when it starts to happen, but maybe even more important is when does it stop happening, because we're looking for how to end these things earlier.
Exactly right. And another crucial thing is often there may not be very obvious triggers for why that is happening, but what is certainly going to happen is that in response to that, the caregiver is going to do something. And inadvertently sometimes, even by instructing the individual to stop doing it, it may be sufficient for some individuals, but for others, and if you begin to argue with him and show your emotional reaction, your anger, annoyance,
frustration,
yeah, that may in fact be reinforcing that type of behavior. So I think it's also very important for caregivers to pull back and examine what they are doing in response to that. Having said that as well, and you mentioned the lady where in public her family member begins to engage in this, um, it may well be also that it's how the caregiver interprets that kind of humming
Mm-hmm.
that may be part of the problem that is lowering the frustration tolerance on the family member's part, you know. So then the family member needs to do some work in thinking ahead, being a little bit proactive, and saying something to themselves like, when this happens in public, I'm going to take some deep breaths, I'm just going to relax, and I'm going to stay with it. I also, if I've been observing and I understand the problem a little bit more carefully, I know that I can distract him with this topic, for example, and you can shift him and get him out of that kind of mode.
Now, we were talking about people who know the patient well, know his history, so they might be already armed with clues as to what's a good distractor. But let's say we've got someone who's nursing home staff. So they're not as familiar with the patient, except they only know the patient from the last 2 months that he's been living in the facility. What are some ways, given a nursing home environment, to safely distract a patient who may not be able to get out of their own repetitive cycle?
Well, in that situation, they probably would call me in, or somebody like me. And if they have that available. But I think in any case, when somebody enters an institution, a nursing home, for example, I think it's the onus is on the caregivers, the formal caregivers in that facility, to know as much about the patient as possible. And then armed with that, you can then begin to have perhaps a list of things that are distracting for that individual that you can engage in a good way. Yeah, in a good way, that you can engage him in. It could be a hobby of some sort. It could be something that the individual likes to do. It could be puzzles, you know, jigsaw puzzles, things like that you can distract him away from that. Now he may well hum as he's doing the jigsaw puzzle, but then the question becomes how disturbing is it, you know, to the caregivers, and it can be very disruptive. It can be disruptive to the other people.
To the other residents.
Yeah, it can be disruptive in that fashion. And then maybe what you could possibly do in a nursing home, you could maybe try to train the humming to occur in a specific place.
I see.
Maybe just in the individual's room,
Mm-hmm.
you know.
Or in the recreation room where people are making noise anyway.
Exactly, things like that.
Okay.
And you can, by differentially trying to, you know, distract in this situation, and when the individual stops humming, give him a lot of kind of social attention and positive feedback. And then in another situation where the humming is less bothersome for everybody, you can allow that to happen. So you're beginning to kind of differentially shape that behavior.
Right, and this is definitely one of the strong themes of the handout that you created. And one of my take-home points was that whatever response you give to that behavior reinforces it.
For the most part, yes.
If you get angry, that
Yeah.
actually can reinforce it,
Yeah.
as opposed to being seen as or processed by the patient as a negative
Exactly.
reinforcement. It's not really a punishment if
Yeah.
I yell at you for the humming, for instance.
No, I mean it could work with some people, but if you
Well,
argue,
I'd rather not be yelling.
but if you argue with somebody, if you try to reason with somebody, and again with somebody who's got brain dysfunction, where he's not able to process the environment as well, including the verbal environment, the people in his environment, then you know, reasoning with him kind of really does not make any sense. But in behavioural terms, any response to that behaviour potentially can contribute to maintaining it and increasing its frequency and strengthening that.
I think a lot of us don't realize that.
Yeah.
Or in the heat of the moment, we don't realize that
Yeah.
that's what's happening. So I appreciate the idea of the pulling back and observing when it starts, what exactly is happening, what am I doing in response to it, and then how these things all fit together.
A very important thing is, if you observe and you now have a snapshot of the behaviour, the challenging behaviour that you're faced with, you now are armed with that knowledge, and before you enter those types of situations, you should already be talking to yourself, much as an athlete would when he's preparing for a competition, that in this situation I have to watch out for this and this and this and this, and when that happens, this is what I need to be doing. So you're going in proactively, you're intentional, you're no longer just reacting, you're being proactive. So I think that's crucial.
Listening to you, I'm thinking these are good rules for life,
Yeah.
not just with patients who have dementia. My last question for you is, again, back in the nursing home environment, we have a lot of people who like to wander, which may be some degree of self-stimulation again, but unfortunately they'll wander into other people's personal spaces. And tugging on them may elicit an aggressive reaction. So what's the best way to try to redirect or distract
Don't
people?
tug.
Don't tug.
No, again, and I think in the handout, I think I've emphasized it enough. The first thing you would need to do is, again, you need to observe, because is it a specific room that there's a preference for? Does the individual go to a specific room? Is there an individual that he's kind of drawn to that's kind of attracting that kind of behavior? So understanding that better, I think, will again begin to give you some information that you can maybe use in trying to solve the problem. But that reminds me of a patient that we had on the behavioural neurology unit a while ago, who with frontotemporal dementia.
I remember him.
Who used to enter people's room looking for candy.
Mm-hmm.
And that was one of the problems. Not only that, I mean, he used to enter the psychology department office at one point. He used to go down to the gift shop to look for candies. He'd solicit people in the corridors asking for money so he could buy candy. He had a sweet tooth.
Mm-hmm.
And one of the things that we implemented with him, and people with FTD in the earlier stages, of course, they understand language. You know, we could explain to him that if he could refrain, for example, from entering somebody's room for 5 minutes, he would get a token. Okay, and once he'd accumulated a certain number of tokens, he could exchange that for a preferred kind of a reinforcer, which in this case was an edible one, like candy.
Mm-hmm.
That's what he liked, right? And we bought like sugarless candies, but it was something that we could reinforce him with. And we gradually increased the period from 5 minutes in order for him to earn the candy to 10, to 15, 20, and so on. And we managed that behavior quite well. So that's it's an example of how to shape the not going into people's room. Or another way to look at it is almost, you could almost even give him the tokens to begin with that he could spend for candy. But in order for him to do so, for example, you could give him 50 tokens to begin with, and he would have to refrain from entering somebody's room, let's say for 10 minutes, and then he would buy candy, but it would cost him 30 tokens, for example. So what that means is in that 10 minutes, he would need not to lose more than 20 tokens,
Mm-hmm.
because every time he did enter somebody's room, it would cost him something. He would take a token.
Okay. As
So there's
opposed
those
to, so you can pay up in advance and then take something away. Oh, okay.
Exactly.
Okay.
So there's different techniques like that. Now, you know, in an institutional setting, it makes it a little bit more difficult because there's all kinds of other things going on around, where some behaviours can be reinforced unintentionally by others, by patients, by other residents. In the home environment, which is more controlled, and if you've just got one caregiver, for example, trying to deal with that, you could begin to use some of those things. But I don't think, I know that for sure, that families are not trained in these kinds of things, but some of them are relatively easily to pick up and implement, and with support, you know, make sure things are happening properly.
Okay. Well, so I'll make sure that the handout is available on your website,
Okay.
so that people can refer to that. I remember the call letters are ABC, and that we have many ABCs of this and that, but remind me what your ABC is.
ABC, A stands for antecedent, and it basically means what comes before. It's the trigger, potential trigger for the B, for the behavior. And the behavior needs to be an observable one. It can't be something that you say, well, the patient became, or the resident, my family member became embarrassed. It's not something you can see. What you could possibly say is, went red in the face. So every observer looking at that would say, yeah, we all noticed the redness in the face. So get away from assumptions, just stick to the behavior, which also helps you to not interpret behavior in a way that kind of is not very helpful. You know, he's doing that on purpose, for example. You know, just look at the behavior, see what form it takes, and then the C stands for consequence, and it's what do I do in response? What's the environment's, usually the interpersonal environment's response to that behaviour, you know? And that's the ABC